Hi, everybody. This is David Nevins for City Biz, and thank you for joining us today. We have a very special guest, and she is Amy Shlossman, and Amy is the relatively new president and COO of Sinai Hospital and Grace Medical Center in Baltimore. Amy, thanks so much for joining us today.
Thank you for having me.
Well, welcome to Baltimore, Amy. Welcome to your new position. I think as far as hospital presidents are concerned, you took a relatively unusual route to your hospital presidency at Sinai, one of Baltimore's great medical institutions, which you have no doubt learned all about and now are fortunate enough to lead. Tell us about your path to Sinai Hospital.
Sure. It is a bit of an unusual path. Healthcare was a mid-career shift for me, although I've always wanted to be in healthcare. But I spent about the first 15 years of my career working in government, state level, federal level, local level on disaster management and emergency response. So you could say that those years were preparing me for the complexities and the unknown of healthcare, and certainly being able to jump into challenging situations.
Well, so I think you're jumping into that right now, and I know that you have a vision for what you're doing at Sinai. I know that you have some future goals in mind, and I know specifically you want to see a continued emphasis on quality, safety, and issues like that. So talk a little bit about that at Sinai and what you've done and what you plan to do in that regard.
Sure. Well, the focus and the mission of LifeBridge Health to really focus on our patients first and to think about our patients holistically and their needs both within the hospitals and outside in their communities, and ensuring that we are delivering excellent patient-focused care to every patient was one of the key things that brought me to Baltimore and brought me to LifeBridge and Sinai and Grace. And so that is a key focus of mine for our team. And that is to be the healthcare provider of choice for our local community, for our patients, for our physicians, and for our team members. And we're doing that through some very specific focused work around building a strong team, ensuring that we are providing excellent, safe, quality care to every patient who comes through our doors, and ensuring that we have access to care for every member of the community who needs to seek health care at Sinai and Grace.
And so, very well said. But so toward that end, I know, for example, that you can share the details, but you and your colleagues at Sinai have been the recipients of some special quality awards of late that I know you're very proud of. So share that with our audience, if you don't mind.
Of course, we are very proud of the quality, safe care that we provide to every patient. Sinai was recognized for the third year in a row by the Maryland Patient Safety Commission for Circle of Honor of Excellence Awards. And this is focused on initiatives that are being driven by our bedside staff and members of the care team to identify issues that will improve the safety and the quality of care for our patients. So Sinai Hospital received 3 awards this year, and we're very excited to celebrate with our team and really continue the momentum around this high quality care that we provide to every patient every day.
So I think I probably know the answer to this next question, but based on your recent comments, but what attracted you specifically to Sinai and LifeBridge in terms of coming there to continue your career? I know reputationally in the Mid-Atlantic, they have an outstanding reputation, but I'll ask you what attracted you specifically to Sinai.
Sure. So it was around this time last year, and it was suggested to me to look at an opportunity at Sinai Hospital in Baltimore. And the more I learned about the organization, LifeBridge Health, the more I learned about the vision and the spirit of Sinai Hospital and the incredible legacy of Grace Medical Center, the more interested I became. I was looking for a health system that really approached patient care from a community health perspective, that thought about patients not only when they were here with us in the hospital, but was focused on their healthcare post-discharge and providing that continuum of care to patients to try to make the healthcare experience, which we know can be very challenging to navigate, more seamless. And I think I really found that in LifeBridge, because in addition to the 5 hospitals and medical centers that LifeBridge has, we also offer a full continuum of care, from urgent care to primary and specialty care outside of the hospitals, complex care within the hospitals, and then a network of post-acute care as well, from home health to skilled nursing to assisted living. Really, there are so many different connection points as you think about a patient's care journey and where they may need to access healthcare. And I was very intrigued about that holistic, connected approach. And my hope that that resulted in a much better experience for the patients and for the communities that we serve.
So Amy, so you probably drove by Sinai Hospital maybe for the first time, I think you said about a year ago, and I don't live far away at all, so I drive by it all the time. There's a lot of construction going on, and share some of the good things that we have to look forward to in Sinai's future.
Yes, the construction is to create some great offerings for our patients. So our emergency department right now is going through a major renovation and expansion. Within the next year and a half, we will have doubled the size of our emergency department, which will provide an even better patient experience for our patients who are coming into the emergency department. At Sinai, we have very focused areas of care within our emergency department, specialized care like a pediatrics emergency department, specialized behavioral health, and we simply needed more room for the patients seeking care. And so you can appreciate that renovating and expanding an emergency department while keeping it open, particularly a level 2 trauma center like Sinai that's very busy every day and every night, is a challenge. But our team has been doing an extraordinary job working around the construction zones. We're excited with each part of the emergency department that we're able to open. We opened a new ambulance bay and ambulance offloading area last fall. We also opened up a new pediatric emergency department just in time for respiratory season this winter. And so over the next year and a half, we'll continue to expand and open up additional areas of the emergency department. And then on the other side of our campus is where we are very excited to be building our new cancer center building. And what's, I think, so important about this cancer center is it really is taking a variety of services that we have spread across a pretty large campus and hospital and pulling them all into an integrated cancer center. So this will include infusion therapy, radiation oncology, specialty oncology care, medical oncology. It'll be a one-stop shop for our patients and for their families to be able to access oncology care. We also offer oncology to both pediatric and adult patients. So I think will be a real gem in our community for the patients in need.
Well, that's good to know, and I think our viewers would be very interested in that. And despite the renovated, expanded emergency department, hopefully none of us have a reason to visit there too soon, but it's nice to know that it's there for the community. I think, Amy, besides Sinai, with which I'd like to hope that many of our viewers, if not most, are familiar. I think there's less familiarity with another area of your responsibilities, Grace Medical Center. So perhaps you could bring us up to speed on that as well.
Sure. And I was fortunate. I was just at Grace Medical Center this morning, meeting with our, rounding on our team members, wishing them a happy Valentine's Day, meeting with our leaders. And so Grace Medical Center is the former Bon Secours Hospital in West Baltimore that LifeBridge acquired and is working to rebuild in the community. So Grace Medical Center is a busy freestanding emergency department, along with an array of outpatient services to support the local community. So we offer everything from primary and specialty care at Grace to dialysis, outpatient behavioral health, outpatient substance abuse. So it's really serving the local West Baltimore community. And then if they need inpatient services, we make connection points back to Sinai and to our partner hospital Northwest. So again, it's really taking that integrated approach to healthcare to provide healthcare closest to where our patients are in their neighborhoods and their communities, and making sure that we're providing that high quality patient experience every time.
And I know, as I'd like to think of myself as someone who gets around Baltimore a pretty fair amount. I know that community is very appreciative of the fact that you're providing such high quality healthcare there as well.
Well, I think we're really lucky with the team that we have at Grace. It is a team of longtime leaders who are and team members who have worked in West Baltimore for many, many years. Just this morning, we were reflecting about some employees who have just celebrated their 50th work anniversary at Grace. And it's not unusual that whenever I'm at Grace and we're rounding on the team members, that I'm meeting team members who have been there for 20, 30, 40 years. So it's really this deep connection and commitment to the local community.
So another area of your responsibilities, Amy, is something that I'm not familiar with at all. Although I'm familiar with the location on Preakness Way, having been there many, many, many times. Tell us about LifeBridge Health's Center for Hope. What is that all about?
Well, I will tell you, the Center for Hope is a very, very special place. And it was one of those key things about LifeBridge that drew me to this community, to this role. So LifeBridge takes, I think, a very progressive view when it comes to thinking about violence as a public health issue. And so the Center for Hope, which was the former Baltimore Child Abuse Center, is focused on violence intervention and prevention through a suite of programs, from having responders that are integrated into the hospital emergency departments to be able to support patients when they come in, to team members who are out in the community who are actively working with the community to prevent crimes and to prevent violence. Again, it's a full suite of programs around violence prevention and intervention. And it's just something that we're all very, very proud of.
Yeah, as you should be. And I know there's a great need, perhaps somewhat unfortunately, but there's a great need in the community for the services that you're providing. So kudos to you and your colleagues for that. Let me end a little bit on a lighter note. I know you said you've been here less than a year, and if I'm not mistaken, you moved here from Arizona. I'm assuming you didn't just see snow for the very first time, right? You've probably seen snow before. How do you like Maryland compared to Arizona?
Maryland is wonderful. I did spend several years in Washington, D.C. years
Okay.
ago when I was in the federal government. So, no, not seeing snow for the first time, but I'll tell you, I'm a bit of a weather wimp. And so, when we had the first snowstorm a few weeks ago, I wasn't totally prepared for it, but I will be going forward. So, I was able to find a home very close to Sinai Hospital. So, it's great to get to know the neighborhood and to be part of the local community. And, I'll get better and better at the winters.
Well, you probably have heard from your colleagues that, even this year, at least thus far, we've probably had more snow than in the previous several years added together. So it's not really a regular thing. Hopefully, none of us have to get too used to it.
I appreciate that. When I was talking to everyone, almost a year ago, and they shared, it hasn't snowed in years here. And so I said, as soon as I come to Baltimore, this is going to be the winter.
So, Amy, let's just in closing, you've I'm sure whet the appetites of many of our viewers to learn more about what you're doing and learn more about either LifeBridge Health, Sinai, or Grace Medical. How should one go about doing that?
Sure. Go to lifebridgehealth.org. That is where you can find all sorts of information. It's where you can find where to access care, whether that's an urgent care center, an emergency room, a specialty provider, or even a primary care provider. So we have a great website that will connect patients and community members to the great providers that LifeBridge has.
Well, this has been a wonderful interview, Amy. I want to congratulate you again on your 3 Circle of Excellence Awards from the Maryland Patient Safety Center. Keep that up. I know you are. And I hope many of our viewers have the opportunity to drive by and if needed, to visit you at one of your facilities for outstanding, state-of-the-art, high-quality medical care. Again, congratulations and kudos for all that you do to you and your colleagues at LifeBridge Health.
Thank you so much.
This has been David Nevins for City Biz. Amy, thank you for joining us, and thank you for joining us as well.